Hi, my name is Dr. Erika Krumbeck. I'm a naturopathic physician and founder and owner of Montana Whole Health here in Missoula. You can check us out on the web at mtwholehealth.com or on Facebook, facebook.com/Montana Whole Health. So today I'm going to talk to you guys about postpartum depression and its relationship to postpartum thyroiditis, which is a thyroid problem. So I'm going to share first my own experience with postpartum depression. I remember it very clearly. It started about 6 weeks after the birth of my first child, Annika, and I remember that it was on a Friday, specifically that I realized I had postpartum depression, and Annika was colicky, or so they said. She cried uncontrollably for about 45 minutes. This was before we knew that she actually had silent reflux. So she cried for 45 minutes, I cried for 3 hours. And that's when I knew that something was wrong. So before I had Annika, I knew that I was passionate about treating kids with naturopathic medicine, but really it wasn't until I became a mother that I realized the incredible need for treating moms as well. So if I got postpartum depression and 10 to 15% of the general population gets postpartum depression, then that's a lot of women that really aren't being diagnosed and aren't being treated sufficiently, I think. In treatment of postpartum women now has become a huge part of my practice. Like I said, I think it's really underreported, it's undertreated, and frankly, I found that conventional medicine has really few treatment options available for women who don't want pharmaceuticals. And for nursing moms, which are, a lot of moms or most moms, there aren't a lot of options that are safe for nursing as well. So that's why, I've devoted a percentage of my practice time to research and making videos and blog posts to help women with PPD. So my approach to PPD, postpartum depression, which is really just like my approach to treatment of many of my other conditions, is to figure out what the underlying cause is. My patients by now have had that term underlying cause beaten into their heads. So I got to tell you, in my practice, probably 9 out of 10 times, and really it's probably more than that, my patients that come into me with depression really have something else going on. In fact, I've never seen normal lab values in a patient with depression. That's because depression happens really any time the body runs out of resources. So you have iron deficiency anemia, guess what? You're oxygen deprived and you're going to feel awful. You have kidney problems, guess what? You can't keep a correct electrolyte imbalance. You're going to feel terrible. You've got intestinal problems, dysbiosis. Well, guess what? You're not going to be absorbing nutrients like B vitamins or iron, and maybe you have iron deficiency anemia. All these things that help keep your cells running, which includes your brain cells, which makes you feel really lousy. So I'm going to talk about these other problems in more detail in future episodes, but this time we're going to stick with the thyroid gland. So ditto for the thyroid gland. If you have low thyroid, you're going to feel pretty lousy. So this is a thyroid gland. It's a little hormone secreting gland that sits in the front of the neck. You can kind of see where it is in that picture. And you can actually feel it on yourself. You can kind of touch right below your Adam's apple. You can feel it the best when you swallow. If your fingers aren't very sensitive, you might not know what you're actually feeling, but it feels a little bit spongy. It normally enlarges in pregnancy because you need the extra thyroid gland to support you and your child, your baby, your growing baby. So a little bit more about the thyroid gland. It basically sets the metabolic rate for the entire body. So that's why people who have too much thyroid, called hyperthyroidism, they feel like they've had too many cups of coffee. And if you have low thyroid, you feel opposite of that. Usually you feel sluggish, fatigued, depressed. You can have dry skin, hair, and nails. Basically, if you don't have enough thyroid gland, your cells really can't convert fuel to energy. So you can imagine how bad that would feel. So it's no surprise that someone with a low thyroid gland function would be fatigued and really be depressed too. So a couple things more about the thyroid gland. It requires iodine to make thyroid hormone. So that's why I recommend all the moms in my practice to keep taking a prenatal vitamin if they have postpartum depression for multiple reasons. But one is the iodine, so it should be an iodine-containing prenatal vitamin. You do not want to take too much iodine. I see this happen a lot where people get really gung-ho about taking iodine, and actually you can cause an autoimmune condition in your thyroid gland by taking too much. So too much is bad. It's inhibited by soy, peanuts, and uncooked brassica family vegetables. That's like the broccoli, cauliflower, and kale. But honestly, this has been really hyped up in media, especially internet media, with people saying, "Oh, I have hypothyroidism because I eat, a cup of kale a day," and that's almost, it's extremely unlikely, is what I should say. So, if you're eating massive amounts of soy and uncooked brassica veggies, maybe, but I rarely see people that actually eat that much, and you can cook it and get rid of that. So. That last point is that it uses a little protein. This is important as a shuttle. It shuttles the hormone around in the body in this little protein that I kind of call a school bus. And you'll see why that's important in a minute. So when we measure thyroid gland function, we measure TSH, which is the thyroid stimulating hormone. It's oftentimes confusing for people because a high TSH means you usually have a low thyroid gland function. The TSH is what the pituitary gland in the brain secretes. So the brain is monitoring the levels of thyroid hormone. Thyroxine is thyroid hormone. And if it senses that there's not enough, it produces more TSH to signal the thyroid gland, saying basically, hey, there's not enough thyroid hormone, we need more. But there's a problem sometimes because, sometimes the thyroid gland gets the message, but it can't actually make any more. So if it can't produce any more thyroid hormone, thyroxine, then the TSH will just keep going up, and the thyroxine level will stay the same or low. But it's really important to test more than just TSH. So here are the terms. Let's go over the terms again. Low thyroid is hypothyroidism. High thyroid is hyperthyroidism. Normal low thyroid conditions. So in a normal condition, you're going to have a high TSH and a low T3, T4. And a lot of doctors will only test the TSH. That's a mistake because not everyone has a normal thyroid condition. So as a naturopathic physician, I want to know the levels of your actual thyroxine, the T3, T4. Those are just different types of the thyroid hormone without getting into too much detail. I want to know the amount of that binding protein, that shuttle, because if you have too much of it, then you can't, then all of the hormone is on the bus and can never get to where it's supposed to be. I want to know the amount of free hormone. So the binding protein we measure by thyroid uptake, or TU. The amount of free hormone is a calculation called FTI, or free thyroxine index. And sometimes I might even want to get a measurement of how the thyroid actually gets converted. That's reverse T3 or RT3, and that's a measurement of kind of the degradation of the hormone. It can be a tricky one. So then we want to know if there's an autoimmune condition happening. And it looks like, postpartum thyroiditis is really quite common. 5.4% of the general population, 1 in 20 women. That's a lot, and that's really not being screened very well at all. So postpartum thyroiditis, itis is just inflammation, has a variable course. So what's tricky about it is that some women actually fluctuate between too much thyroid and too little thyroid, hyperthyroid and hypothyroid. So you can see how treatment can be really challenging. So, do you think that you might have it? Well, let's go over some of the symptoms. In the hypothyroid state, the low thyroid, you can often get fatigue, depression, cold intolerance, thinning hair, nails, dry skin, often this really sluggish, slow feeling. That can be tricky too because it's normal for women to lose hair in the postpartum period. So sometimes women just think, well, I'm postpartum, I know you're supposed to lose your hair. But when it's excessive, I'd rather you check your thyroid and make sure. In the hyperthyroid state, it's a lot of anxiety, palpitations. I've seen migraines. And then paradoxically, there can be some fatigue too, and actually depression with hyperthyroid as well. And that's kind of like a burnout fatigue. Like if you've had, 10 cups of coffee and you've been so jacked up that your body's basically exhausted from being so jacked up. So how is it diagnosed? Autoimmune thyroid conditions are diagnosed by measuring the antibody levels. Anti-tpo and anti-TG antibodies are antibodies against different parts of the thyroid gland. Well, really, they're against different parts of the process of making thyroid hormone, but I don't want to go into detailed specifics. So anti-tpo is usually king. That's usually what we order first. But if I'm super suspicious, I'll order anti-TG as well. Sometimes you can order the TSI, but that usually is to diagnose Graves' disease. Conventional medicine doesn't really have a lot of options for treating postpartum thyroiditis, and that's really sad. They kind of say, we don't know, use your best clinical judgment. If you have hyperthyroidism, you want to block the effects of the thyroid gland, so you get a lot of anxiety and palpitations, etc. If you get hypothyroidism, their only treatment is basically supplement thyroid hormone, which does make folks feel better, but in my opinion isn't really treating the cause, because the cause is the inflammation, and they're never really addressing that. Naturopathically, we've got a lot of options for treatment, and I wish I could give you guys more specifics, but that would probably be multiple blog posts and multiple videos. But basically we treat it like any other autoimmune disease. Selenium first, and this is a quote from the resource that I got most of my stats from. Their quote is, selenium decreased the incidence of postpartum thyroiditis as well as permanent hypothyroidism, which is pretty common after getting PPT, when compared with a placebo control group. But then they conclude, but we don't really know that much about it, so let's not do it, which I think is really stupid. So when I treat postpartum thyroiditis, or really any thyroiditis, I do use selenium. I usually use selenomethionine. And I'm not really supposed to give treatment over the internet because I haven't seen you in person. But let's just say, theoretically, in the case of postpartum thyroiditis treatments, selenomethionine is usually dosed at around 200 micrograms per day. That's micrograms, mcg, not milligrams. So that's just theoretical, what some people have done in the past. We also have a lot of other options for treating the immune system, and this really depends on the patient in front of me. I always do a complete physical exam, and if they've got some gut problems, we'll help treat the gut, and that's huge, I must say. Treating the leaky gut syndrome, adding probiotics in, eliminating food allergens can help a lot. By the way, if you get probiotics, which is one of my favorite immune modulators, you absolutely must get a high quality probiotic, not the junk that's sold over the counter at a supermarket. The Culturelle brand is pretty good. You can find that at most places, but the rest is just garbage, so skip it. It's not worth your money. So there's lots of immune cells in our gut. That's why we like to treat the leaky gut syndrome. We also like to add antioxidants in. Turmeric I find to be very helpful. I recommend liberal amounts of turmeric to be eaten with food. You really need to have fat with it to absorb it, though. And the emotional component is huge. I have yet to see an autoimmune patient without some sort of emotional component to their healing process. And that honestly is one of the coolest parts about being a naturopathic physician, that we get to recognize that healing occurs on so many levels at the same time. And actually there's a lot of really good research on that too, how our emotional state can affect our immune system, and that's pretty neat. I also like to address the overall toxic burden. Sometimes I'll test for heavy metals. I don't all the time, but if we're suspicious, I usually do. And if I'm suspicious, I almost always find elevated heavy metals, and we can treat that very gently first. And if we absolutely have to, we can chelate someone too, but I don't really like to do that. So I hope this was helpful for you guys. That was my brief but thorough-ish sort of report on postpartum thyroiditis. If you have questions, please ask them on my blog. There'll be a blog post that's associated with this video, and I'm happy to answer them for you.